Well, hello there. It's good to see you again right here on Health Diary. My name is Winnie Lubembe. Thank you so much for making the time to join us on this conversation, which will be focusing on autoimmune hepatitis. And as they say, healthy livers are the foundation for healthy lives. But when we talk about autoimmune hepatitis, what exactly does it mean? Who is at risk of the same? And are the symptoms the same as the other types of hepatitis that we've heard and talked about? And that is hepatitis A, B, C, D, and E. Well, we'll find out after this fact of the matter.
Autoimmune hepatitis, a rare but serious condition, is a chronic liver disease characterized by inflammation of the liver due to the body's immune system mistakenly attacking healthy liver cells. Patients with autoimmune hepatitis can have a range of symptoms from asymptomatic to chronic illness or acute liver failure. All right, let's get to understand more about autoimmune hepatitis. And to help us with the conversation, we have on my immediate right, we have Nyambura Mariga, who is a liver patient. And she's also here to share her journey as far as autoimmune hepatitis is concerned. And we have Dr. Christopher Opiu. He's not new here. And he's a consultant gastroenterologist as well as hepatologist from Aga Khan University Hospital. Dr. Thank you so much for making the time. And to you too, Nyambura, as well. Thank you for agreeing to come and share your journey with us. So, Doc, we hear a lot about hepatitis C, hepatitis B, hepatitis, I don't know, A, and all these other things. But autoimmune hepatitis, we rarely, talk about it. So how different is it? And first of all, what is it?
I think the definition is very clear. So it means that your body sees your liver cells as abnormal. The reason why it does that, we are not so sure why. Sometimes we think it runs in families. It may affect the young, but women are most affected. And it may be genetics, it may be hormones and so forth. But there are a lot of other factors, including environmental factors. The liver is the largest organ in the body. And you need to destroy about 70 to 80% of it before you begin to have either signs or symptoms. So most people or patients with autoimmune may not know about it. However, there are certain cases where you have the liver being affected. So you have what we call a rapid destruction of liver cells. So some of them may present in that stage. Overall, the only way we can know that you're having autoimmune hepatitis is basically we find out that you have abnormal liver function tests, which is a blood test. And even then, we have to rule out the other common causes, okay? And for one to make a diagnosis, usually you need a liver biopsy as part of the criteria. And not everybody wants you to poke a needle into your liver, but it's invariable that So we need quite a number, and we also do blood tests to look for other markers that suggest autoimmune hepatitis.
Do you see a lot of patients who come in at advanced stages?
Yes, we see a lot of delayed diagnosis and sometimes missed diagnosis. And then the other problem is that sometimes when you have destruction due to, say, drugs, the picture is almost similar to autoimmune. So you do not know which is the head and tail, or which is the egg and which is the chicken. Yeah. So sometimes I may have autoimmune. It may be slight. I may have smoldering around there in my liver. But when I take a certain drug, it kind of augments and makes it worse. So sometimes we may say, okay, you've developed drug-induced liver injury, yet you do have autoimmune on the background.
Oh, I see. Nyambura, can we go back to 2007 is when you got your diagnosis? But before then, there must have been some things that took you to the hospital, right? So what was it? How were you feeling before you got your diagnosis?
I remember I used to feel very tired. And also I noticed that my belly was getting really big. And I somehow just wanted to be on the ground. Every time I stood up, I just wanted to sit down. So my belly got bigger and bigger. And that's when I went to the hospital.
Okay. Yeah. Didn't know what was happening.
No idea.
All those things. All right.
No idea.
So what happened? Like, did you get a number of tests done?
Yes, I got admitted, got a number of tests done. I think I spent about 10 days. They wanted to do the biopsy just as Dr. said, but in my case, they did some blood tests to show some markers. They also took out the fluid out of my belly. And yeah, they told me I have autoimmune hepatitis.
Okay. Did you know at that point what that was about? And
I had no idea. I think for me, I just Googled what autoimmune is. And in the simplest terms, they told me, your body is viewing your liver as foreign. So it's attacking your liver. But the cause of it, I had no idea.
Yeah. And Dr. you mentioned a little bit something to do with family. So I'm just going to ask for you, your family, is there anybody?
No, nobody.
Okay.
Nobody.
All right. And Dr. so we don't know what causes the body to fight against, and start attacking the cells and all those things.
Yeah, it's like it's individualized. It's different for different people. Okay, but we know that you being a lady, a woman, or female gender, you're at risk. Yes, and there are certain cell markers that point towards that, etc. And of course, there's the element of family risk, but it's really low. Okay, so and the disease is not as common as, say, hepatitis B or maybe hepatitis A, where you drink your water and you get or whatever and so forth. Yeah. So, so as I said, people miss out on the diagnosis.
Yeah. And you talked about fluid in your belly. Say before you noticed, and when you noticed, like how long ago was that until it became a concern for you? Because sometimes we tend to ignore these things. We're like, maybe I ate something,
I'd say a month, because at first I thought maybe it's my diet, I'm just adding weight or something like that. But I also noticed just like the shape of the belly looked weird, on the sides. So that's when I decided, let me go to hospital and have them check it out. Yeah.
Doc, can we tackle the fluid in the belly and how that happens, why it happens?
Okay, so if it's an acute episode, basically it just may be a reaction, but most of the time when you do have fluid in the belly, it means that the disease has been ongoing for some time. And it's related to increased pressures in the portal system, that is the vessels supplying running from the intestines to the liver. Okay, so you have backflow. The other alternative is that you have low albumin. So if your albumin, because albumin keeps the fluid in the vessels. So those are the two categories. You may have an element of a little bit of kidney impairment for some people. When we do the fluid analysis, it's kind of low on albumin. And it's kind of bland without any cells or something of the sort. So if you have cells there, you know that there's some infection going on. If there's a test we call serum ascites albumin gradient, if it's greater than, say, 11, we think that probably you have increased portal pressures. So just to break it down, it's kind of a backflow and pulling of fluid in the abdomen.
Mm-hmm. And you see some of the symptoms might mimic other conditions. And knowing us, sometimes our health-seeking behavior is not as good. So we tend to wait it out and say, oh, maybe I had a tough day at work or this or that, and especially for fatigue. But is there like I don't want to say like unique, but classic symptoms that you would, when someone just says, you'd say, yeah, this could be, something to do with the liver or something.
So for the liver, basically what we do, we do the usual simple screens. And that includes also an abdominal ultrasound scan because it will tell you about the size of your liver, the texture of your liver. If you have fluid in your abdomen, we do the liver test. For example, we should have expected to find abnormal liver tests and low albumin, and some of the clotting profiles or factors that help with clotting, the tests that we do are on the lower side. So if we find that abnormal, so it's abnormal liver tests, abnormal ultrasound, you can pick up the disease a little bit earlier than late when you're probably having fluid in the abdomen, fatigue, loss of appetite, changes in your sleep cycle, a little bit of muscle wasting and exercise intolerance. Those are the things that happen. And you're also prone to more infections if it's later.
I see. And Nyambura, so we were talking about this before we went, we started the show, and you talked about liver fibrosis and cirrhosis, a few alarms here and there.
Right.
Do you want to take us through that?
So once I was told I had autoimmune hepatitis, I was put on medication. And, of course, I kept with doctors' follow-ups and stuff, even though I was not too knowledgeable about what's going on. So later I started hearing them talking about, I have liver fibrosis. And so I got to understand that the liver goes through stages. And then years later, they said, you have liver cirrhosis. I think Dr. can allude to that in terms of, stages of the liver. And so now, and also with each stage came, symptoms. Like now for my case with the cirrhosis, same thing, constantly tired in the morning, no difference between morning and evening. Just simple activities. I tend to get tired quick. Build up of fluid in my belly, digestive issues. So just finding a way to manage a way all around that. Those have been the stages that I've had to walk through.
Yeah. And the alarms, what exactly happened in terms of how you were feeling and,
I think in terms of alarms that would happen through the stages, I have had what is called variceal bleeding, which has happened to me twice, where they call them varices. They pop and you end up vomiting blood. So that has been one of the major, medical emergencies I've had. I've had, I think it's called a cytic tap, where if it's too much buildup, they have drained it twice. And maybe because of my digestive system, I also have what is called colitis. So when I have flare-up sometimes and it's super severe, then I'll find myself in the hospital.
Oh, I see. Yeah. Doctor, can I explain that before we go on a break? First of all, the staging fibrosis and then cirrhosis and then bleeding and vomiting.
The liver cells are kind of like a pentad. You have a pentad like that. So in the middle, you have a vein and the cells lined up and so forth. Then they go to the biliary tracts and etc. So it happens that when you have inflammation of the cells, the thing about the liver is that it can recover, okay? But if the inflammation or destruction is excessive, it outruns the recovery period. So what happens that you get a lot of inflammation there, and where you have inflammation, it's almost like a scar. So those scars start forming. They take up the space of the usual cells. So you have distortion, problems with flow of blood, problems with changes in the cell, and also problems in production of, say, albumin, clotting factors, and so forth.
So you've had this for 18 years now, but in 2019, you were advised to consider liver transplant.
Yes.
So we'll also talk about that in detail, what that looks like, and even the prognosis after, and all that is coming up after the break. Just stay with us. Welcome back. And just in case you're tuning in right now, today on Health Diary, our focus is on autoimmune hepatitis. And I'm pretty sure majority of you maybe might know someone, or probably this is the first time that you're coming across that term. And we have Dr. Christopher Opiyo, who's a consultant gastroenterologist and hepatologist. Hey, big terms, from Aga Khan University Hospital. And we also have Nyambura Mariga, who is here to share her journey as far as autoimmune hepatitis is concerned. So before we went on a break, Dr., you talked a little bit about diagnosis and classic symptoms and the treatment options, which again is what we want to really, really focus on now. But Nyambura, before we address the course of treatment in the career, we'll handle the medical part. So 2019, you were told it would be good if you had liver transplant.
Yes.
But you had a few concerns. What were the concerns? And and how do you still feel the same now?
I think so many things come to mind once you're told about the surgery. For one is the risk of the surgery itself. And also another concern for me was feeling like my life has to take a pause, and also the life of my family has to take a pause, so that they just see the whole process. They've been willing. My family has been amazing.
They're very supportive. Your parents are here.
Yes. Yeah. But those were the concerns, and also just feeling as if, is this the only solution? You're kind of always looking for, could there be?
Is there something else?
Is this the only way?
Yeah.
So I battled with that since 2019. And, my family kept pushing me. They're like, let's do it. And even within that, we would clash because I feel like, you guys are pushing me too much. But then again, they're trying to do their best. They're offering what they feel is best, and they want to see me okay. But towards last year and this year, I would say my symptoms just started becoming too recurrent. The fatigue got crazy. The fluid buildup, ascites just got consistent, even with the taking of medication to try and drain it out. Digestive issues here and there affected my social life. Just going out, you have to think, restroom, how long will I be out, food. Yeah. So once that started becoming recurrent, and I felt like I'm a very happy, jumpy person, and I almost felt like that was fading away. So I said, you know what, if this is the way to go, then why not? And I called up my family and I told them, I think it's time.
And really, those are very valid concerns, But Dr. So are there options? Because like she said, are there other options, medications that might help?
In black and white, no.
No. Okay.
So it's yes, we can. If you have some residual liver, we can push it. Okay. Because there are some patients we have managed to avoid liver transplant, but they need to come in. It's just a small window, and it needs very specialized to the person treatment. Okay. And the usual textbook management of patients will not work, in my opinion.
All right.
Yeah, so one has to be very flexible. But transplant, I think it is what the standard is, and usually the guidelines are very clear. If you reach a certain stage, we do what we call model for end-stage liver disease. So if you're above 15, we start discussing with you, pushing and so forth. Because we don't do liver transplant in Kenya, we have to send patients out. So it is living organ donor. So it has to be from a family member. And there are certain things we have to go through. Legal documentation, mental documentation, benefit versus risk to donor, recipient, all that. So it's a detail. It's something that takes about 3 months for you to go through, and all the paperwork.
Yeah. That has to happen.
But if it goes out well, I don't have to talk about it. You talk to some of your colleagues and see the differences that occur.
Yeah.
So that's what puts a smile on our faces, and we keep on going.
Yeah.
Otherwise, we want to see you better.
That's true.
Yes.
I mean, because you talked about the recurrent symptoms despite the fact that you're taking medication.
Right.
So I would understand why Dr. is saying push, to go to that direction. Yeah. So you said you've spoken to your family members. Do you have a potential donor now?
Yes, my sister. My lovely
sister. Okay.
My lovely sister.
Okay. All right. And she says she's okay to go ahead with the process, go with the process.
She's been a pusher since 2019. Let's do it.
Yeah.
So she's really happy that I finally came to the decision.
Yeah. Oh, I see that. And Dr. So one might ask, so what would life look like for the potential donor and for the recipient post?
So far, all the donors that have donated, we haven't had any issues. Okay, because usually we evaluate you before, but also evaluation is done independently at the transplant center. The centers where we send you to, sometimes they run, for example, in India, they have national guidelines, and they are a little bit strict. And of course, we make sure that we follow you up and find out what is happening. In certain cases, if we're uncomfortable, we do visit the center and advise against if we think there are gaps here and there. So we try and cover. So most of the donors within a month, they should actually, if you have a healthy liver and they split it, it recovers within the month. Yeah. So that is for the donor. For the recipient, it all depends on how well you are and how well you take up. Sometimes they may have issues with connecting some of the tubes from the other liver to this other liver. Sometimes there's a problem with infections, okay. But overall, if you go over that period, it is very satisfactory. In fact, for me, when you have gone over the period and you come back, I always celebrate and just say, okay. Because it is really painful having a patient come in every week, so fatigued. Every time you see them coming through, you can almost say, oh, I know there's something going on there, and so forth. Yeah. So it's a challenge. But I think transplant is the option, but also early management is also very important.
All right. For kidney transplant, there's sometimes risk of rejection and all those things. Is that the case?
So for liver, the risk of rejection is lower. And the beautiful thing about it is also the drugs that you have to take are less. In fact, I wouldn't tell you this, but I'll tell you the truth. There's some patients, some of them could not take all the immune suppressants, but they're still doing well, but we still follow the standard.
That is Dr. Christopher Opiyo, who's a consultant gastroenterologist as well as hepatologist right here at Aga Khan University Hospital in Nyambura. Thank you so much for your time. Nyambura Mariga shared her story and her journey with us, and we wish you all the very best.
Thank you.
Very best.
Thank you.
As you, consider and even plan to go for liver transplant. We can't wait to see you after.
Yes.
We have this conversation.
For sure.
Time now for you to take a look at this health tip.
Today's health tip, we are focusing on fruits and how you should think about fruits. We advise you to eat the whole fruit because that way you get the fiber and the water that comes with it, as opposed to drinking the juice.
Well, from today's conversation, we've learned that by the time you experience some of the symptoms as far as liver fibrosis or cirrhosis or a condition affecting the liver, it must have destroyed 70 to 80% of the liver. So that goes to say that we should be very aware of ourselves and our bodies and seek help whenever we feel something is not right. All right, so I hope that you've learned a lot from today's conversation. My name is Winnie Lubembe, and a special thanks to the Aga Khan University for hosting us today. Until next Sunday, adios. You don't know that the body is attacking itself, and in this case, attacking the liver. So it is all in our court. The body is in our court, I'm sorry. All of us included, to take care of ourselves and ensure that our health-seeking behavior is... Guy, I'm sorry. It's not coming out the way I want.